Let's talk about sciatica. What's really causing that awful radiating pain?
You'd think a bigger herniated disc on an MRI means more pain, right? It just makes sense. The typical thinking is pretty simple. Something's physically pressing on a nerve, and that's causing the pain.
But is it really that simple? Well, a recent study put that exact idea to the test. And they looked at everything, not just the MRI, but also inflammation, infection, even psychological factors. So they studied 40 patients who were all scheduled for surgery for this exact kind of nerve pain. And the verdict? Well, it was a total surprise. The obvious physical stuff wasn't the answer. In fact, the study found no link between pain intensity and the MRI or inflammation levels. Okay, so if it's not the physical damage, then what actually is making the pain worse? The study pointed to something else entirely: how our own minds and bodies handle pain signals. First up is something called pain catastrophizing. It's basically our tendency to magnify a pain's threat. And second is your body's own pain dampening system. Think of it like a volume knob for pain. And here's the connection. Higher catastrophizing plus a faulty volume knob equals way more intense pain. Another interesting find, gender also seemed to play a role in the average pain intensity reported. So the big takeaway is this: your experience of pain isn't just about the physical injury. As the study says, our psychology and biology seem to matter more than what the images show. Which leaves us with a huge question. If pain is more than just an image, how should we treat it?